Hi everybody, this is Nevzat speaking from Cyprus IVF Hospital. Today we're going to talk about what is genetic testing, who can benefit from genetic testing, and does it improve the success rate for the IVF. So there is different type of genetic testing that we apply at our hospital to the embryos. Okay, so first of all, we need to distinguish between what is genetic testing that we apply for the patients and what are the genetic testing that we are applying to the embryo. So today we're going to speak about the genetic testing that we are applying to the embryos. There is different type of genetic testing around the world. The general name for that before was PGD. So everyone was saying, oh, do you apply PGD? But there is different type of PGDs around the world, and there is new names that is established by the institution to make distinguish between the different type of the genetic testings. At our hospital, we apply PGT-A method, which there is a different type of PGT-A. We check 5 chromosomes with fish method, 7 chromosomes, 9 chromosomes, and also we apply NGS where we check all the 23 chromosomes. So that is the which one you would like to go is decided by you by getting suggestion from our doctors and medical experts. So one of the most important thing nowadays is to know when is the best time to take biopsy from the embryos. Most of the patients they're asking, oh, do we harm the embryos when we apply the genetic testing? Because genetic testing is done through the biopsy taking from the embryos. So when we create the embryos on day 1, we monitor them very closely to see their development until day 3. And then from day 3, we monitor their development until day 5 when they come to the blastocyst stage. Some of the clinics around the world, they were taking the biopsy on day 3. And then they were sending them to genetic lab to see the results, if they're healthy or not healthy. There is main reason that why they were taking it on day 3. If the patient wants to have a fresh transfer and they don't have any chance to come back to the clinic, then you could apply PGT-A 5 or 7 or 9, and then you would on day 3, and you would have get the results on day 5, and then you could perform the fresh transfer. This is the one of the main reason of some of the clinics they apply day 3 biopsy and do the fresh transfer on day 5. However, we recommend day 5 biopsy when all the embryos reach the blastocyst stage. Then we take a biopsy on day 5 in the morning, and if the patient wants PGT-A 3, which we check on the 3 chromosome, or PGT-A 5, which we only check 5 chromosome, we are able to get the results on the same day, late afternoon or evening, so we could perform the fresh transfer to the patients if they're okay with PGT-A 3 or 5. However, if the patient wants to check 7 chromosome, 9 chromosome, all NGS, which means all the chromosome we check, then we will not able to perform the fresh transfer. Then we have to go with the frozen transfer. Our recommendation in most of the cases is to apply NGS to who the patients have a problem with miscarriage before, recurrent IVF failures, and the age above 35 years old. With that, we are able to check all the chromosome. Then we get the results between 2 to 3 weeks. You will receive the full report from us and see which of the embryos are healthy. Then, with single embryo transfer, we increase the chance of pregnancy rate. In North Cyprus, we are allowed to transfer up to 3 embryos in one transfer, but with NGS, you know the quality, you know the health status, then you could even achieve very good pregnancy rate with 1 embryo transfer. But of course, this is depending on the embryo quality and the health condition of the patient, age of the patient, and fertility history of the patient. There are different roles there are different indication playing a huge roles on how many embryos should we transfer at one transfer. So that's another topic. I will not go into much details. Then we also apply single gene genetic testing at our hospital. What is single gene? So if a patient having a known genetic disorder and she or he has the report saying that this is the mutation type that we are having. I'm just going to give an example. For example, it's really popular at the moment, BR2AC. So it's actually a mutation showing that you have a high risk to have a breast cancer in your genes. Or some patient has a sickle cell. So these are the single gene identified problems coming from the genetically from the patients. So when they have such a report, then what we could do after we create the embryos from the patient, with that mutation report, we can apply a single gene to the embryos to identify from each embryo if they are carrying that gene which will cause the problem for the baby. So then we can eliminate unhealthy ones and we can only transfer the ones that only carrying the healthy genes, not the one that's coming from the family as a genetic disorder. So this is also another genetic test that we apply at our hospital. So who should consider the genetic testing? As I mentioned before, a patients who are having a recurrent IVF failure, patients who are having recurrent miscarriage, patients whose age is above 35, 37, that they old reserve, the egg reserves, they're not in a good shape and they might have chromosomal disorder after we collect the eggs and create the embryos. We suggest definitely to increase the success rate to apply NGS to those embryos. A patient who has inheriting a genetic disease from their family and they don't want to take risk to inherit these potential genetic disorders to their babies, they can also prefer our hospital to apply the single gene method to basically eliminate those unhealthy embryos and move forward with the healthy embryos. So the cost from the genetic testing, it depends. But for example, at our hospital, to apply NGS to check all the chromosome for each embryos cost €400 for each embryo. So it's not costly. If you have 6 embryos, basically you will get €2,400 to apply full chromosomal check to your embryos. And of course, we have a special discounts on some cases. That's another thing to we'll discuss it with the patients one-to-one, because we really try to get patients healthy and successful embryo implementation. Because at the end of the day, it's not just to pregnancy, it's also the healthy pregnancy and healthy delivery of the baby. Any question if you have about the genetic testing, please visit our website www.cyprusivfhospital.com, and you will see that under the genetic testing you will able to reach all the details about genetic testing that we apply at our hospital, what we are checking, what will be the cost, and why we are applying it. Thank you very much.